Hello, everyone. My name is Solomay Tibabu. I'm the host of the Going Digital Behavioral Health Tech Conference. I'm so excited to have Jonathan Mayhew here, CEO of OnTrack, along with Dr. Hilary Platzik, the Senior Director of Medical Economics at OnTrack. Thank you both for being here. Why don't we get started with Jonathan and Dr. Platzik, if you want to do some introductions?
Salome, good afternoon. Jonathan Mayhew, the brand new CEO for OnTrack, and I'm thrilled to be here with you today, and I'm also thrilled to be at OnTrack. So thank you.
Can you tell us, what is OnTrack?
OnTrack is a behavioral health organization that has been committed to improving the lives of people with chronic conditions and behavioral health needs.
Thank you so much, Salome. It's great to be here today, and I'm excited to engage and continue our conversation. My name is Hilary Platzik. Hello, everyone. I'm an epidemiologist by training, and I come here at OnTrack. I've been here about a year with about 20 years of applied public health research experience. I started off as a shoe leather epidemiologist out in the field doing basic needs assessments, and have worked through in a variety of analytic environments, working with large data to improve population health outcomes at scale.
Amazing. Thanks so much. In the same order again, if you could tell us a little bit more about personal mission, what drew you to OnTrack, and more about your work?
Sure. I've been in healthcare my whole life, and always have been interested in opportunities to help change the healthcare delivery and service improvement for customers and patients and employees and members. I'm excited to do that in the behavioral health and chronic disease area, given the prevalence of chronic disease and the undiagnosed behavioral health components that are associated with that. Personally, I know firsthand some of the limitations in trying to access behavioral health services for my family. Like many individuals, we've been tested around issues of resiliency. My wife and I, a number of years ago, were diagnosed within the same month with fairly advanced cancer treatment or cancers. And our treatments required a lot of sacrifice for the family. Unfortunately, my wife's diagnosis turned out to be very late stage, and unfortunately, it was metastatic, and she was not able to survive the course of treatment that she was exposed to. So, with young children, we were faced with trying to find out what we need to do to deal with grief and make sure that we handled bereavement for young children and adolescents in a way that helped make sure that our family moved forward in a resilient, positive fashion. So, I learned firsthand the importance of what it takes to make sure that support networks, families, and the roles of supporting behavioral health and in a certain set of circumstances for my family. But it certainly sensitized me to the importance of making sure that there was greater connectivity and understanding of the services that are available, and how to make sure that when people need timely access to those services, that they're available and in a clearer, more appropriate way. And so it's not been an insignificant factor in sort of helping to create my pathway to join OnTrack. And I appreciate the opportunity, Salome, to help share that with you.
Wow, thanks so much for sharing. Besides your incredible professional experience in healthcare, definitely understanding the needs of the members you're serving is very significant. Thanks so much. Dr. Platzik, can I ask you the same question?
Sure. Thanks so much, Salome. Jonathan's a hard act to follow because I do admire his mission and heart. And similarly, I have been committed and working in healthcare my entire career, and it's just over 20 years now. Was brought into the healthcare and medical field, raised by parents who were really invested in their community and committed to the greater good. So I'd say that's the family background in terms of my background and upbringing. But through a background in public health and commitment to population health and behavioral health improvement, I also have personal connections to the fragmentation and inability for our healthcare system to treat a number of conditions for individuals in our current society. So have family members with autoimmune disorders, with side effects of anxiety and depression, and understanding firsthand the overwhelming nature of what specific types of diagnoses can do for feeling the need to be connected to services. And that's very difficult sometimes to work with individuals who receive chronic or acute disease diagnoses in ways that help with mental health. So most recently, just being able to help family members feel connected to talk therapy and support services has been really challenging. Even when these services exist, people may not want to engage for a variety of different reasons. And so it's one of the reasons I'm drawn to OnTrack, because our care coaches are committed to working with individuals in ways that are engaging. And through the work I'm going to talk about soon, we're really seeing results in terms of what that means around reduction in avoidable utilization and increase in services that are associated with behavioral health services and preventive care. So I think between the family background and my upbringing, my commitment to making our healthcare system more integrated and impactful and value-based, and the mission that we have here at OnTrack, it's a great place to be. And I feel grateful to be here.
Yes, now more than ever, solutions like this need to be available. So many people are struggling. So I'm excited for you to talk more about the work that you're doing at OnTrack. And to get us started, Jonathan, for those who aren't familiar, can you talk about what is OnTrack? And your leadership marks an exciting new chapter. What's in store ahead?
Sure. OnTrack has got amazing people. We have competitively positioned digital capabilities. We've got industry-leading proven results, which we'll talk about here shortly. So some of the foundations for us to continue to build upon are really exciting. I think for us, some of the next chapters will include going beyond the health plan cost savings model that the company has been built around. I think we can be significantly more relevant around value-based care. And I think we'll continue to evolve our product and go-to-market strategies as it relates to becoming more relevant to the highest acuity cost burden and disease burden for the industry. So we'll look to evolve our product and go-to-market strategies. I think that there are a number of ideas that we will look to advance pretty quickly around some of the engagement and coaching capabilities that we have. I think our ability to continue to use technology for further assessment and identification of disease and conditions that may present themselves in claims information, and for those conditions that don't necessarily present themselves well through a claim pattern. I think care pathways can continue to evolve for our organization as we deepen our partnership with primary care physicians, the condition management programs that our customers already have, and our ability to share those deepened care pathways with our therapists and the treating clinicians that our members are so closely aligned with. So our ability to go deeper around product and clinical innovation, I think you should expect to see from us over the next 6 to 8 months.
You recently released an exciting study. Can you tell us a little bit more about that?
Absolutely. I hope you can see how thrilled I am to be talking about this today, but we recently completed some foundational work measuring the impact of the OnTrack program from a longitudinal cost and utilization perspective. These results matter now more than ever, I would say, because we need to be able to quantify how care coaching programs can help reduce avoidable utilization among people with behavioral health conditions. As you may already know, and other people listening today may know, there are tremendous gaps in care for individuals with behavioral health conditions like substance use, depression, and anxiety. Behavioral health conditions are largely underdiagnosed and undertreated in the U.S., and we know that about 1 in 5 Americans live with behavioral health conditions, and only about 2 in 5 of those people receive care each year. Now, that might be outdated data, I do want to name that. There is probably, some of these measures are pre-COVID. So post-COVID, we can imagine a world where those statistics are much different. We also know that individuals with these conditions are major drivers of cost in the U.S. healthcare system, doubling or tripling cost of care, and that these higher costs are usually driven by increases in predominantly avoidable utilization.
Super interesting. So can you tell us a little bit more about why you decided to do this study?
So hopefully that intro data was kind of setting the stage, but we wanted to understand long-term changes in cost and utilization associated with enrolling in OnTrack as an indication of the value that a program provides. These results provide evidence to support our hypothesis that the OnTrack program decreases plan paid cost as well as unnecessary healthcare utilization while increasing behavioral health and preventive care encounters. This analysis also helps us understand how the program delivers real-world impact on healthcare use and associated cost, and builds the evidence needed to demonstrate this value to existing and potential customers, but as well as the larger scientific and clinical communities and folks from other communities listening today.
Wow, that's amazing. Can you talk a little bit more about what it is that you did to carry out the study?
Absolutely. Now I could talk about this for a while, but I'm going to provide some high-level details, and excited to also answer more questions. So we simulated a randomized controlled trial, or RCT, which is the gold standard of comparative effectiveness research to better understand the effect of the OnTrack program, or treatment effect. We used 36 months of continuous eligibility administrative health plan claims data between 2013 to 2020, so several years of longitudinal data. And because it is possible that there are differences in those who enroll in our program and those who do not, it's important to build treated and controlled cohorts that are as similar as possible. Propensity score matching is a rigorous statistical methodology that matches treated and control members based on a set of criteria, resulting in a balanced matched comparison that is as similar as possible to our treated or enrolled members. It's like having a Hillary Plazik in both groups based on clinical, sociodemographic, and cost-related features. The use of this approach ensures that this is not regression to the mean, but rather real change correlated with our program. So we identified a treated cohort as those who enrolled and completed the OnTrack program, and used a one-to-one propensity score match method to identify an identical comparison cohort of individuals who were eligible to enroll but never did. We calculated differences in costs and utilization between that 12-month pre-enrollment and 24-month post-enrollment time period for both groups, and then describe the differences of those values. This is the difference in differences calculation. And to do that, we wanted to understand per member per month savings and then change in utilization in the treated group over time relative to the controls. So that final sample, once we did that, was about 1,800 people. Actually, excuse me, it wasn't about, it was exactly 1,800 people. That's 900 graduated and 900 never enrolled. The average age was 58 in both cohorts. We had a 50% Medicare Advantage, 50% commercial, and 64 to 65% female. There were comparable Elix-Hauser comorbidity scores in both cohorts, and the top 3 general comorbidities included hypertension, diabetes, and chronic pain. Top 3 psychiatric comorbidities were no surprise to us, because it's part of our selection criteria, but they included anxiety, substance use disorder, and depression. One note on this study design is that it may be difficult for some health plans to conduct this type of study design, since their ability to do a longitudinal study over 6 months may be limited, and it may be difficult to track course of treatment throughout 36 months since the analysis required continuous eligibility data.
I can't imagine how much work goes into that, but that seems very rigorous, which in light of so many new digital health solutions today, not a lot of companies can say. So that's me answering a bit of my next question to you for why do these results matter?
Well, they matter because what we found, and we're really excited to report, is that there were statistically significant savings of all-cause medical costs over 24 months of $486 per member per month among our treated cohort when we compared to pre-post costs against our controls. That means that individuals who enrolled and completed the OnTrack program saved on average $486 per month over a sustained 24-month time period after enrollment, compared to those who never enrolled. That's just shy of $12,000 per member over 24 months. The members in our study cost an average of about $2,700 a month before and then $1,500 per month after, and that equates to a 44% reduction in pre-post cost. So this savings was largely driven by a reduction in inpatient utilization. We found a 64% reduction in inpatient encounters, $488 per member per month difference in different savings for inpatient admissions. And we identified statistically significant increases for all-cause office visits at $110 per member per month. And that equates to a 50% increase in all-cause office visit costs. That means that individuals who enroll in our program have fewer inpatient encounters and use more services with respect to office visits compared to those who never enroll. We also saw similar trends in our SUD, or substance use disorder, attributable and behavioral health attributable care. It is important to underscore, again, and I know I mentioned this earlier, that the study found cost savings and changes in utilization continued for 12 months after the program ended. That's an indication of the durability of our program, and it's evidence of the lasting impact of our approach and part of the value that OnTrack provides across our book of business. So that's a little bit of the summary of the findings and why does this matter, which is ultimately where I spend a lot of time thinking about, well, we have this elegant study design and these really amazing, very almost neat and tidy results, candidly, but why does this matter? But really why it matters is that evidence indicates that people with behavioral health conditions experience extraordinary gaps in care to treat their conditions. The results I just laid out identify a post-enrollment patient journey that shows increased utilization of behavioral health services with respect to office visits and reduced consumption of inpatient and ED services, which signals an increase in productive care and a decrease in expensive avoidable utilization. So these results also provide real-world evidence to support our hypothesis that OnTrack delivers sustained long-term cost savings over 24 months and also decreases plan paid costs and unnecessary healthcare utilization. At the same time, we also see that behavioral health and preventive care utilization increased, signaling an increase in productive care and a decrease in expensive avoidable utilization. So for comparison, in early May, an article published in JAMA described the effects of 2 RCTs. They were a low-touch digital intervention to help patients with depressive symptoms, which is very valuable. Results indicated improved depressive symptoms at 3 months when compared with enhanced usual care. However, that magnitude of the effect was small, and the effects were not sustained at 6 months. And I use this only as a comparative example because OnTrack's treatment effect study has the benefit of a more generous longitudinal study design, and our analysis included longer follow-up time and sustained cost and utilization savings over 24 months. Compared to other disease management programs, this is much higher PMPM savings and indicates substantial clinical value and cost savings. And finally, the results allow us to say that if we invest in behavioral health, we keep people out of the hospital. And these findings provide support for the shift towards integration of behavioral health interventions impacting long-term cost savings. And that's so important as we develop a perspective of value-based care here in the United States, focusing on behavioral health interventions integrated within clinical settings so that more people get the right services at the right time.
That's amazing. How exciting. What's next? Where do you go from here?
Well, we're really excited about these results. We're really excited to share it with you today and think through why this matters for the organization and for other people and our customers. We're currently working on publishing these results in a peer-reviewed journal with academic colleagues and advisors from Stanford University. We're also pursuing sub-analyses looking at specific subpopulations of the cohort, as well as drivers of cost savings and utilization with more granularity. We also planned on building upon this foundational work using other types of strategic research studies that begin to demonstrate the value of the OnTrack program with respect to clinical outcomes, patient quality of life, and dose response of the OnTrack program. So we have a lot more work to do. We're excited to roll this out and continue to ask questions that are meaningful.
Dr. Plazik, Jonathan, thank you both so much for being with us, and congratulations on these exciting outcomes. Really appreciated learning more about your study and the great work you're doing with OnTrack.